Hi, have you decided to undergo breast augmentation to increase the size of your breasts? Has your plastic surgeon told you the incision through which the implant will be put? If not, let me discuss them with you. So, the first and the most commonly done incision is the inframammary incision or the submammary incision. Now, this incision is given in the inframammary crease, which is the crease under your breast where the breast meets the chest wall. Now here, if you give the incision, what happens is that it will be covered by the breast in front, so it will not be seen normally. Also, it gives us very good access to the exact plane through which we can go and put the implant in the right plane. When you lie down and when the breast is lifted up, the incision will be seen, so the scar would be seen. However, it's a very fine line scar. Now the next route, which is also fairly commonly done, is the transaxillary incision. That means through the axilla or through the underarms. Now, this is not a very well preferred incision, or I would not want to recommend it for the reason that one, axilla or underarms are not a very clean area through which we would like to go through and put the implant through, because the risk of infection will be high. Also, every time you lift your arms up, the incision might be seen or the scar might be seen. Also, through this incision, we may not be able to bring the implants to the center. So the cleavage would not be that well formed with the transaxillary incision, and the the implants will tend to appear a little bit on the sides rather than towards the center. Now the third incision is the periareolar incision. So this incision is given around the nipple areola. So what happens is, see, this is not a straight line. In normally also the nipple areola is a little ragged in appearance. So when you give an incision and it heals, it gives a very natural look. May be difficult to identify it as well. But the disadvantage is, in females who are planning to have children in future, we might cut a few mammary glands or their lactiferous ducts during the insertion of implant through this incision, in which case breastfeeding at a later date may be a little problematic. So that has to be kept in mind. But for patients who have completed their families, this is an excellent incision. So please discuss with your plastic surgeon, and if you want to know anything more, you may contact us on the number which is given below.